So I'm Anissa Mitchell with PMD Alliance, and I'm really excited to have this conversation today about fatigue. So with us today is Dr. Joseph Friedman. He's a neurologist and chief of Butler Hospital's Movement Disorders program. He's also a professor and chief of the Division of Movement Disorders in the Department of Neurology at the Warren Albert Medical School at Brown University. And he's adjunct professor in the School of Pharmacy at the University of Rhode Island. Dr. Friedman has done extensive research, especially in behavioral aspects of Parkinson's, and he's been very interested in fatigue and PD, which has not been well explored and what we're going to be talking about today. He's published numerous journal articles, as well as a book that you can get on Amazon called Making the Connection Between Brain and Behavior, Coping with Parkinson's Disease, and a free online guide called Parkinson's Disease, a guide to Parkinson's disease for patients and families. And I'm going to drop the link to that in the chat so you guys can get that. And we'll drop it again later in case you miss it. But I'm going to welcome Dr. Friedman, and I'm going to pass this over to you because I know everyone is very excited to learn a little bit more.
Okay. So can you see my screen? Yes. Okay. So fatigue is a very challenging problem in Parkinson's disease, and I can remember very clearly how I first got interested in this topic. I was a relatively young neurologist, obviously interested in Parkinson's disease, and had a patient who was probably in his mid-40s, who had mild Parkinson's disease. And he was working full-time, and he told me that he was coping with his Parkinson's disease pretty well. He worked full-time. It was a physical labor job that he had. But at the end of the day, when he came home, he couldn't do anything. He just had to lie down. He wasn't sleepy. He didn't nap, but he just felt like he couldn't move. He just had no energy left. And every day was like that. And he said, you know, this is by far the biggest problem that I've had with Parkinson's disease. And that intrigued me because I had never heard that before. At least if I did, it didn't register in me. And so I started asking patients about fatigue. And it turned out, of course, to be a common problem. And as Anissa mentioned, there are a large number of people who signed up for this talk, presumably because fatigue is a big issue for them as well. I have to advance my slides. And it's not clear how I do this.
So I can see that it's up, but it doesn't look the same as it did before.
Yeah, maybe try resharing the PowerPoint.
And while he's getting that situated, I dropped the link to his free book. If you guys want to capture that, I'll add it again towards the end of the program today.
Well, thank you for that advice. It clearly worked. So I like to use this quote, which is from Plato. So obviously, over 2,000 years ago, that even back in his day, Plato wrote this: "For this is the great error of our day in the treatment of the human body, that physicians separate the soul from the body." Now, he, of course, was not talking about soul in a religious sort of sense, but soul as being sort of the makeup of what makes a person, that their behavior, their emotional interests, their whole life story separate from their body was what he considered the soul. And, even then, he noticed, I guess, that people concentrated, the doctors at least concentrated more on physical ailments. And that has been one of the big problems in treating people with Parkinson's disease. And when I was in training when I was a resident, so it's a long time ago. Back then, really the sole focus in Parkinson's disease was on the physical manifestations, about tremor in particular was a big item, walking, balance, issues that are important issues. But at that point, the only kind of non-motor problem that people thought about was depression. Even then, people realized that depression was a problem that was increased in people with Parkinson's compared to the general population. But aside from an interest in depression, where the major debate was, is the depression part of Parkinson's disease? That is, was it due to a change in the brain cells, or was it what we call a reactive depression, that people who develop Parkinson's, which is not a curable disorder, become demoralized and depressed because they're reacting to their changed situation in life. But beyond that, there really was no interest in virtually any other aspect of Parkinson's other than the physical motor manifestations. So hearing about fatigue, it was not a recognized problem at that point. And I started doing a little bit of research, clinical research, finding out about how often fatigue was a problem in Parkinson's, and I'll get to that in a little bit. And I published some papers, and I gave a talk about this at the University of Florida many, many years ago. And shortly after I gave the talk, I got this email from out of the blue, where it said, I'm a 75-year-old man who had Parkinson's diagnosed 5 years ago. I can live with the PD, not great, but livable, but the fatigue is unbearable. As all my life I was of Superman energy, now I'm only good for about an hour or so at a time. And between the lightheadedness and the fatigue, I'm wasted. I take 1.5 pills of carbidopa-levodopa 3 times a day. I take 200 milligrams of Provigil, which is a medicine to help people stay awake, and a bunch of pills like NADH, in other words, supplements. I exercise as best I can and follow eating rules. I've been told to go see a shrink and start on antidepressants. I don't think I'm depressed. I'm retired. No wife or things to stress me out. I've been told fatigue is one of the 3 major problems of having Parkinson's disease. Most of the time I'm horizontal. I was told you gave a talk on this problem. So this is a common sort of feeling, other than the business about no wife or things to stress me out, which when I give this talk in public usually gets a laugh, but would not get a laugh in this setting. But the idea that if you're fatigued, it probably means you're depressed, and that probably means you should be on antidepressants. Not realizing, of course, that fatigue is a very common problem, both in the general population, but particularly in people with a variety of different illnesses, where the fatigue appears to be part of the illness and not necessarily an emotional response. So I actually have a problem reading my own slides because there's stuff on my screen that I don't want here. So here's another email that I got. My husband of almost 40 years has Parkinson's, and fatigue is his most severe and debilitating symptom. At first, I thought he had depression. I attempted to get him interested in the things that we love to do, but it seemed that he lost his zeal for life. When I asked him about it, he told me that he was extremely tired and it almost hurt to try to get up out of his bed or his chair. I started researching all I could on Parkinson's and fatigue, but there was very little information. I felt lost and unbelievably helpless. We went from being participants to spectators in life. With James' fatigue, we have had to alter our lifestyle to conform to his energy level. We go to baseball games instead of fly fishing. We cruise on the local Southern Belle riverboat instead of racing sailboats. We go to the beach and watch the ocean instead of teaching scuba diving. This will be the last one. Fatigue was the first, can't read this, I'm sorry, symptom I noticed and is still now the most debilitating. This feeling of fatigue is different from feeling sleepy, depressed, or apathetic. As an anthropologist who has worked in West Africa, I'm reminded of the fatigue I suffered after coming down with malaria. When fighting malaria, I faced an overwhelming need to lie down. But unlike fatigue from malaria, Parkinson's fatigue doesn't go away after taking a few malaria pills. Finding treatment for Parkinson's fatigue can be a huge challenge. So this is the problem we all face. People are fatigued and we don't understand what it is. And making that even worse is that it's often not recognized. So doctors don't ask about it. Patients may not know enough. It's certainly not back, when I trained, but even these days, patients may not be educated sufficiently about Parkinson's to recognize that this is a problem. And they just kind of feel, that everything is too hard to do, and they become unmotivated, and it creates problems for them, particularly with their family, because the family may view them as just kind of not trying, not understanding that this is a very major problem for them and that it's part of the disease. So the first question to ask is, what is fatigue? So fatigue is a sense of tiredness, lacking in energy, okay? So when we use the word tired, it's really used in two different ways. One who doesn't get enough sleep at night will wake up the next day and say, I feel tired, meaning that they feel sleepy. Running a marathon makes you tired, but not tired in the way that you want to sleep, but tired in the way that you want to rest. And so there's a difference between fatigue and sleepiness, although certainly many people may have both. Now, I'm talking about fatigue, of course, in the setting of Parkinson's disease, but everybody feels fatigue. So you have to think of fatigue as being a normal part of life. I would guess that 100% of people feel fatigue at some point, or fatigue may be abnormal. Making it a little more complicated is the idea that there are different types of fatigue, not just physical fatigue, but mental fatigue, emotional fatigue. And these are different, presumably due to different reasons. And the person's behavior may be different within these different types of fatigue. So first of all, as I mentioned before, fatigue is a common problem. So in a study I looked at that was published recently, that 5 to 10% of all visits to primary care practitioners are related to fatigue. You've also all heard about chronic fatigue syndrome, which is a disorder of unknown cause in which people just feel fatigue and have nothing identifiable wrong with them physically. That is, all the laboratory tests, all their imaging studies, all the tests that can be done don't point up any kind of particular abnormality to sort of pin the blame on to explain the fatigue. But 5 to 10% of visits to primary care practitioners, so that's a huge number, are related to fatigue. And up to 45% of the population, depending on the population and how the study was done, report fatigue as a significant problem. Now, in primary care, so these are PCPs, not neurologists, not movement disorder specialists, almost 20% of the fatigue is thought due to depression, but 70% is unexplained. The other 10% being due to a variety of different medical or psychiatric conditions. Now, among that 20% that's due to depression, of course, you don't know how that diagnosis of depression was made. And so it may be that the fatigue is why they're saying the patient is depressed, but presumably 20% of the patients are depressed. but 70% is unexplained. In Rhode Island, when I did my study, which was actually one of the two first studies done looking at fatigue, half the patients that I interviewed, which was a consecutive group of patients, I forgot how many there were, I think it was 100 or 150 patients, half of them, every single patient I asked about fatigue, and about half the patients listed fatigue as one of their 3 worst problems. That is, considering tremor, rigidity, stiffness, loss of balance, falling, speech difficulties, constipating, all the problems that people with Parkinson's may suffer from. Fatigue was one of the top 3 in half the patients. This is extraordinary because up until that point, if you did a literature search on fatigue and Parkinson's, there were no publications. So even though half the patients reported fatigue as one of their worst 3 symptoms, there was no research being done on it, and it was not even considered as a problem related to Parkinson's disease. Surprisingly, even after that, was that 1/3 of patients listed fatigue as their single worst problem with Parkinson's disease. Now, I mentioned before that there are different types of fatigue. And one distinction I want to make is fatigue is different than fatigability. So a person may feel fatigued without doing anything. They wake up in the morning, and even before they, take their shower, they, put on their clothes, they feel physically tired. And then there are people who fatigue easily. That is, they feel okay, but once they start to do anything or do a small number of things, they start fatiguing. So a person who before could, had Superman energy and could walk around the track or run or do anything, now is limited and can only do a small amount of the exercise that he or she used to do because he or she fatigues more easily. But fatigue is also a problem that people feel even without doing anything. Now we can talk about objective fatigue. So muscles fatigue, that can be measured. If you lift a weight, whether it's a small weight or a heavy weight, as you do it more and more times, eventually the muscle that you're using is going to become weaker and weaker and become unable to lift that weight. We've all experienced this, especially people who lift weights. They can do a certain maneuver a certain number of times, and then as they get stronger, they can do it more. But then as they get weaker, they do it less, and they can't do it forever because their muscle fatigues. That's not the sort of thing we see in Parkinson's disease. In Parkinson's, the fatigue is subjective, that it's a feeling state. A person feels tired. The British use the term knackered, which is a term that I find sort of amusing to listen to. I think it sounds like a very good descriptive term. But people feel fatigued, they feel wasted, they feel drained, and it may be for no reason other than they have this illness. There's physical fatigue, which is primarily what I'm talking about, but people often have mental fatigue. For those of you who may have spent a large amount of time trying to solve various problems, you're writing a PhD thesis, you're trying to prove a theorem, you're trying to make sense out of a bunch of financial data. After doing it for hours and hours and hours, you start feeling mentally fatigued and you really don't want to think anymore. You need to rest your mind. And emotional fatigue. Many people have tremendous emotional stresses in their life that they have to deal with almost all the time. And at points they need a release, they need a vacation, they need to get away from it all. So there are different types of fatigue, and there may be more types of fatigue than I've just mentioned here. I don't claim that this is a complete description, but it's the kind of thing that we've all experienced. We've all had physical fatigue. I imagine that we've all experienced mental and emotional fatigue as well. Now, the big question here is, what constitutes pathological fatigue? What sort of fatigue is abnormal? I mentioned before that we all get fatigue, that developing fatigue is a normal part of life. Where do we cross the line between saying, oh, you're just normal, and there's something wrong? It's kind of like, where do you draw the line in saying, I'm old now, I didn't used to be old? It's not so clear. There's no particular line you can draw in the sand. On one side you're fine, and on one side you have something wrong with you. So pathological fatigue is a sense of weakness, lacking in energy, that interferes with activities you should be able to do and which should give you pleasure, or even not pleasure, but activities you should be doing. So when fatigue interferes in your life and didn't used to, then we consider that pathological. Pathological fatigability is when you develop fatigue that interferes with efforts that there's no particular reason that can be identified that explains it. So it's always a sense of lacking in energy to do things that you should otherwise be able to do. And there are enormous numbers of causes for pathological fatigue. I think that overall, virtually any illness is associated with fatigue, with perhaps one exception of people who have mania, and certainly certain drug highs. But most disorders will be associated with some degree of pathological fatigue. And by that, I don't mean that everybody has a certain amount of fatigue, but that there's a higher incidence of fatigue in any given population. So, for example, common causes of fatigue in the general population are things like congestive heart failure, various infections. I mentioned at the beginning, the person who had malaria experienced severe fatigue when he was sick with malaria. So infections of all type, cancers of all type are associated with that. And one of the ones that I find probably most interesting is radiation therapy. And the reason I find it interesting is that with radiation therapy, the development of the fatigue appears to be fairly uniform. So depending on how much radiation a person gets and where the radiation is focused, most patients will develop fatigue, and the radiation therapist will tell you about it, that you're likely to develop fatigue starting in a certain number of days, and it will keep getting worse until a certain number of weeks, and then it'll stabilize, and then you'll get better. So this is a physiological process. This sort of fatigue, at least with radiation, is not related to any type of emotional state, although probably people who are depressed to begin with are going to feel it more and be more likely to have it. But overall, this is a physiological response, and that suggests that it should be something we should be able to figure out as to the cause. Now, the cause of fatigue with radiation is going to be quite different than the cause of fatigue in people who are depressed, who obviously aren't being radiated in any way. And that's going to be different than how fatigue is caused in congestive heart failure or fatigue from certain medications. Pain causes fatigue. People who are in chronic pain, chronic low back pain, people with chronic headaches, people with bad arthritis are often fatigued, and much more than other people. Anemia is interesting because with anemia, which means you have a low red blood count, so you're not delivering enough oxygen to the tissues of your body, anemia is associated with fatigue. And unlike the other causes of fatigue, gets better when you transfuse the patient. So even though we're not sure why you feel fatigue with anemia, other than you don't have enough red blood cells, that improving the number, increasing the number of red blood cells does in fact improve the fatigue. So we have a number of different things that cause fatigue, and yet the fatigue that the patients experience appears to be pretty similar from one disorder to another. So I mentioned in the first bullet point here that psychiatric disorders often cause fatigue. And the major one, of course, is depression. So depression is associated with an increase in fatigue. And very often for people like myself who are, healthcare providers, it can be hard to tell whether a patient is depressed and that's causing fatigue, or whether they just have fatigue separately. And so far, no distinguishing characteristics have been identified where I could say to a person with Parkinson's disease, who may also have depression, say that, your fatigue is due to your depression. It's not due to the Parkinson's disease. The depression may be due to the Parkinson's, of course, so it's related in that sense. But no, I think it's different, and we treat you with antidepressants, it'll get better. It turns out that if you look at depressed patients, patients who don't have Parkinson's disease, just depressed patients in the general population, fatigue is a very common problem. And in fact, when you diagnose major depressive disorder, fatigue is one of the characteristics that's used for diagnosing it. But when you treat the depression successfully and the melancholic mood passes, so the patient is no longer, sad, patient is no longer unable to feel pleasure, their fatigue may continue. So although the fatigue is due to the depression, it doesn't always improve. And this in the general population. I'm not talking now about depressed people with Parkinson's disease, okay? But even depressed people in the general population who experience fatigue, very often their fatigue persists even if their mood improves. So there's something funny about fatigue, that even though there's this relationship between fatigue, say, and depression or other psychiatric conditions, that treating the underlying condition doesn't always improve the fatigue. Unlike, say, anemia, where you increase the red blood count and the fatigue does go away, or you treat the infection, you treat the malaria, you take the malaria pills, and the fatigue goes away. So fatigue can be related to an underlying illness, and we think the underlying illness is the cause, but treating that so it goes away doesn't necessarily alleviate the fatigue. So that's a very interesting kind of concept, which unfortunately makes it more difficult to deal with. What causes fatigue? We really don't know. As I mentioned before, anemia causes fatigue, and there seems to be a clear relationship because anemia is defined by the red blood cell count, and treating that makes it better. But why does a drop in the red blood count cause fatigue? That's not known. It seems, at least in my mind, that because fatigue feels the same in these hundreds of different disorders that are associated with fatigue, that there is likely some type of similar process in each of these disorders, which to me suggests that there's probably some release of particular neurochemicals, because fatigue has to involve the brain because it's a feeling that we have. Now, the chemicals themselves may not be released in the brain. For example, radiation therapy in the chest doesn't directly affect the brain in any way, but as the radiation affects the cells, wherever they're targeted, it presumably causes release of certain type of chemicals that will act on centers in the brain that may cause fatigue. But we don't know what they are. There have been studies looking to identify changes in chemicals in the bloodstream that might cause fatigue. And a number have been identified, but as far as I'm aware, none have been confirmed. And I'm not aware that anybody's taken these chemicals and injected them, say, into animals to see if it produced a change in animal behavior. So the fact that there aren't known distinguishing features between fatigue, say in Parkinson's disease, and fatigue in depressed people, or fatigue in people with cancer, or fatigue in radiation, it becomes impossible for the clinician to be able to say, well, your fatigue is due to Parkinson's disease, and your fatigue is due to the depression that you have. So frequently, we try to treat something we can treat in the hopes that it might make the fatigue better. A major issue, I think, that involves the family and affects interactions within the family is the connection between fatigue and apathy and motivation. So people with fatigue tend to be less motivated than other people. Now, that's not always the case. And I had another slide, which I did not show, obviously, about a person who complained that they're so fatigued at times that they can't do all the things they want, that they try to force themselves so that they're highly motivated, they feel, but they are nevertheless too fatigued to do these things. A lot of other people, however, are fatigued and become apathetic. They've learned to live with their limitations and become relatively unmotivated so that they don't look forward to things because they don't feel the pleasure. They develop what's called anhedonia, which is inability to experience pleasure. Things become less pleasurable, partly because they're less motivated, and they will say that they're less motivated because they don't get pleasure from the things. And one of the reasons they don't get pleasure is that they feel tired. And when you're tired, obviously, you don't want to go and do things very much. And that is associated also with a sense of apathy, of not really caring. And so there's a strong link among these three problems. And family members who really, who don't know about fatigue often consider this a type of moral failing, that the person has given up, that the person isn't trying. They would do better if they only tried more, and thus, without meaning to, implying that this state of affairs is the patient's own fault. And that's really not the case. Certainly, we should be trying to get patients motivated. We should try to get them to enjoy life more and try to overcome the fatigue if at all possible. But we have to do it with a sense of understanding that fatigue is unfortunately built into this disease, at least in some people, not in all. Now, something I hadn't mentioned before is the connection between fatigue and other aspects of Parkinson's disease. It's an interesting observation that in most studies, not all, there's no relationship between how severe the Parkinson's disease is and the fatigue. So a person with bad Parkinson's disease, a person who can barely walk or is wheelchair bound and very stiff and slow, may not experience fatigue, whereas somebody like the first patient I talked about who was a relatively young guy who was working full-time, was nevertheless able to work full-time at a physically demanding job, and suffer from severe fatigue. There's also, well, not a clear connection between fatigue and depression, although obviously depressed people are more fatigued than more likely to suffer from fatigue than non-depressed. But the fact that a person has a lot of physical difficulties does not mean that they're fatigued. Another observation has been made that people who are fatigued usually remain fatigued. That once it starts, it can go away, but by and large, it tends to remain, but may not worsen, but sometimes does. So there are a lot of patients who will say that although they first noticed the tremor, say a year ago or 3 years ago or something like that, that they started feeling fatigued 5 years ago, that fatigue may precede the development of the Parkinson's. They go to their primary care doctor. Primary care doctor says, I don't see anything wrong with you. Your fatigue must be an emotional condition. Maybe you're depressed, maybe you're developing depression, and they treat it with antidepressant medications. When I mentioned fatigability before, I can never stop recalling an article that was published many years ago about a famous soccer player in UK named Ray Kennedy. And Ray Kennedy was evidently a star back in the 60s or 70s. And he developed Parkinson's disease. And there is a video that accompanied the article about him, showing him running and scoring a goal, but not swinging one arm, which obviously in retrospect, signaled that he had Parkinson's. But he reported that for years before the Parkinson's was noticeable, that he was always the last one out of the training room after the game was over, that it took him hours to recover from playing compared to everybody else. And then when he developed the identifiable signs of Parkinson's and was diagnosed, then it became clear why that was the case. So here's a guy who had physical fatigue, or fatigability really. He wasn't fatigued until he started playing, but fatigability, but obviously no problem with apathy or with motivation. So I mentioned that some people with fatigue develop a loss of motivation or decrease in motivation. They often develop anhedonia, which is a reduced ability to feel pleasure. And that's, of course, associated with motivation. You're not going to be motivated to do things that you don't particularly enjoy. And that may lead to a sense of demoralization, which is that, why should I do this if it's hard for me and I don't get much pleasure from it, which then leads to increasing problems with a vicious cycle, including depression and more apathy and more demoralization. And it's a very, very difficult kind of vicious cycle to interrupt. Apathy in particular is a problem because it is a change in the personality, so that a person becomes somewhat different than they had always been. They kind of lose their spark, sort of the joie de vivre, the joy of being alive, because they simply don't care. And although that's different than fatigue, it does have a relationship to it. Now, how to treat fatigue is unclear, okay? So it's not as simple as you're going to your doctor and saying, I have fatigue. I heard this guy Friedman talk about it. So now you got to put me on this medicine so I'm not fatigued anymore and my life's going to turn around. We don't know what the cause of fatigue is. I mentioned earlier that I think, at least, that there probably are chemicals released in the body from tissues that are outside the brain, possibly inside the brain as well, but a variety of places in the body that may lead to the feeling of fatigue. But we don't know really what they are, and we don't know even if that statement is true. There was a study that I did with some physiologists many years ago, looking at exercise capability in people with Parkinson's disease, looking at one group of patients who were fatigued versus patients with Parkinson's who were not fatigued. My idea was that maybe people who were fatigued were less efficient in their exercising, so that everything they did cost more energy than people with Parkinson's who were not fatigued. And when we did this by measuring how much oxygen they used for a certain amount of work, on a bicycle, we found that there was really no difference at all. So that the physiology as manifest by how people moved, that a person was stiff and slow, so it cost more energy in order to do some exercise, that did not translate into any difference in anything that we could measure, and didn't translate into any relationship to fatigue, which of course we probably could have just deduced from the observations that were made that people with bad Parkinson's are generally not much more depressed than people with mild Parkinson's, that it doesn't have to do with the actual physiology. So how do you treat fatigue in Parkinson's? Well, the answer is unknown. But there is an approach. We have algorithms that we tried, and probably each of us neurologists who treat a lot of Parkinson's have different algorithms. All of the medications that have been tried in double-blind placebo-controlled trials, that is the standard way of proving that a medication is effective or not, have not been successful. Okay. First of all, in approaching this, we try to treat all the potential contributing factors. If a person is depressed, treat the depression. If the person has heart failure, treat the heart failure. If they're anemic, treat the anemia. If they're on medications that might be contributing to it, medications like the sedative medications, anxiety medications like Valium or Xanax or clonazepam, Klonopin, that you try to reduce those medications. So treat any contributing factors or reduce medications that might be contributing. Try to slowly increase endurance by slowly increasing exercise. It's important when you do this to set reasonable goals. You can't go from walking, 100 yards to walking a half a mile in a week. You have to just increase things very gradually and hope that as you increase endurance, you increase confidence, and you may increase, exercise capability, and then reduce fatigue. There are some data in cancer patients that this can be helpful. In many cases, it's difficult to tell, especially in Parkinson's disease, whether a person with fatigue also is depressed. Since we don't have a clear treatment for fatigue, it may be helpful treating for depression, even if you're not sure depression is present. The important thing there is, if the antidepressant doesn't work, then you should stop it. Antidepressants usually need several weeks in order to work, so it'll be a trial that should last a few months. I like to use stimulants, medicines like methylphenidate, which is Ritalin, or amphetamine salts, which is Adderall. But the data on that really don't support its use. I think that they are safe even in older, frail people, but they do need to be used carefully, and they are controlled substances, so they're difficult to prescribe. And again, when you use a drug like that, if it doesn't work, then you stop it. There are some people who have recommended dopamine agonists. Those are drugs like pramipexole, ropinirole, rotigotine. I have not, because sometimes they make people sleepy. Increasing levodopa has not proven effective. Medicines for narcolepsy, for excessive sleepiness, have been tried and have not proven successful. So we really don't know. I think the single most important thing is for the patient and the family to understand that this is part of the disease. It's not a moral failing and needs to be treated as another symptom of the disease. It's important to encourage exercise. Exercise is always helpful in Parkinson's disease, but the person should not be made to feel guilty for feeling fatigue and not being able to participate as much as people would like him to or her to. And with that, I will close. I have to tell you that there are people who are doing research on fatigue in Parkinson's disease, but it's a very challenging thing to study, because of course we don't have animal models to work on. So I'll be happy to answer any sort of questions that come up, and we'll turn it over to our moderators.
Okay, thank you. And actually, Dr. Friedman, that was going to be one of the first questions I asked you, was about why there seems to be so few studies focused on this particular issue, because it's clear that it's a significant problem for many, many people, a huge quality of life issue. And based on all of the information you just provided us, which was fantastic to understand, how intricate this is, it's kind of hard for people to even be able to clearly articulate to their doctors what is going on. So, is this something you think that might be a focus in the future, or even some ways that people can better understand and describe what they're experiencing, so that it can be, I guess, combed out? Is this something related to depression? Is it, related to maybe a medical issue, or is this simply an experience they have with Parkinson's?
I think the important thing is to try to distinguish this fatigue from sleepiness, because sleepiness can be treated, usually, not always, of course. I think the important thing is to recognize for the fatigue as separate from sleepiness, that fatigue is a problem, and to be discussed with the doctor, and to see whether there might be mitigating factors, like other conditions that are playing a role that can be helped. I think the future of research is in a few different possible areas. So the easiest one probably is to just do sort of fine assessments, that is, assessments that ask a large number of questions in different types of fatigue, to see if there are ways of distinguishing one type of fatigue from another. That's one sort of thing. What we call the low-lying fruit when we do research, the easy ones are, just asking how many people have fatigue, what the percentage is, how severe the fatigue is. Does it affect old people more than young people? Does it affect women more than men, or men more than women? Is it associated with this condition or that condition? Is it the same in different cultures, which it is pretty much around the world? That's where some of those things have been done. The important thing is trying to identify objective or physiological markers. As probably everybody is aware, what are called biomarker research is a big thing in a large number of neurological disorders, particularly Alzheimer's, but also Parkinson's disease. We're trying to find things we can measure in the blood or the spinal fluid that correlate with some sort of tangible aspect of the disease. So if we were to find certain, chemicals, hormones that change, that are correlate in some way with fatigue in Parkinson's, it would be a big step forward. And at this point, probably you just have to screen for large numbers of chemicals in large numbers of patients and hope that something comes out in the wash. But it's not exactly a scientific approach. Well, it is a scientific approach, but it's not, a finely honed, it's a strategy that's crude, but probably is what needs to be done.
So there's a question, because you mentioned, several symptoms of Parkinson's, and some of them could cause fatigue or a feeling of sleepiness. So one of them being low blood pressure. Does that have an influence? If somebody has a problem with low blood pressure, is that something that would influence that experience of fatigue?
That's an interesting question. I actually don't know the answer to that. Certainly it sounds plausible, but generally, at least in my experience, people who have low blood pressure are generally feel pretty okay until it becomes very low, in which case they feel lightheaded or their legs feel wobbly. They don't generally report to me that they're fatigued. But to be honest, I'm not aware of any studies on that. I wouldn't expect that to be the case, but I certainly could be surprised. I wouldn't be amazed. I think that I've not heard of people who had their blood pressure raised, people with low blood pressure who had their blood pressure raised, feel less fatigue, or people stopping their antihypertensive medications feeling less fatigued as a result. I'm sure it happens to some people, but I don't think it's a general property.
And you mentioned exercise. We had a couple of people that had asked about that. One person saying, I'm sleeping 9 hours a night, no problem. You can take a nap during the day, no problem. But when they exercise, they have extreme fatigue, physical, mental, and emotional fatigue. And there was another question about, that they just don't get that benefit from exercise. Is there something you can say about that? Because often we say exercise is one way to combat fatigue. It gives you energy, but is that always the case for someone with Parkinson's?
Well, certainly it's not always the case, and people's ability to exercise often is compromised by physical problems. But, in a case like that, what I would try to do is figure out how much exercise a person could do at one time without overextending themselves. And it may be 5 minutes, it may be hopefully more, but it might be a very short period of time. And I would try to do that amount more than once a day. Most people who exercise once a day, and that's it for the day. And so I would try to exercise, say 5 minutes, twice a day, then 3 times a day, and push themselves and slowly go from 5 minutes to 6, 6 to 7, and so on. And I realize that it's easy for me to say this, and it's a harder thing to do when you actually have the problem. But that would be my approach to that problem. And I would also consider using stimulants. But, this is a very general discussion. I'm not recommending necessarily that patient go to their doctor and say, put me on Ritalin.
Right. And how much would you say there is a tie to, well, I'm sure there is, but like when someone is fluctuating fatigue with their motor fluctuation. So obviously it's worse in the off state. And one person has said that they try to stay ahead of their afternoon fatigue and off period, not allowing the fatigue and off period to get started. But there's just that fine balance of that in battling that fatigue and off experience and then dyskinesias. So is that something that's pretty common in terms of off, is the fatigue?
That's a very interesting question. Okay. In my experience, people who are fatigued generally, although their fatigue may fluctuate during the day, they generally feel fatigued most of the time. People who, obviously, if you fluctuate and you feel more fatigued when your medicines aren't working, you're going to do what everybody does, which is try to increase your on time and decrease your off time, and hope, and presumably your fatigue will respond as well. So that's a kind of fatigue that is treatable, and when you can't adjust the medicines properly, it might be time to be thinking about an infusion pump or deep brain stimulation.
Okay, and that makes me curious. Is there any change in the experience of fatigue with DBS?
I have not seen a study on that. There may be studies on that. I don't know the answer. My guess is probably yes, that it probably improves it, but I doubt that anybody would offer DBS as a treatment for fatigue. I think that the benefit would come about as suggested by the question you asked 2 times ago of the person who fluctuates. Yeah. That with DBS, you eliminate or markedly reduce the fluctuations and you reduce the dyskinesia, so the extra movements. So I would expect that fatigue might improve as well, but I actually don't recall seeing studies. I think it would probably vary a lot depending on the population that was getting DBS and why they were getting DBS.
Right. Yeah, that was a loaded question. I guess we're close to the end. So we have had a couple of questions around how do we help the loved ones with PD stay motivated if they feel fatigued. Another person was like, is there benefit to helping them set goals? And like you mentioned earlier, maybe doing 5 minutes 2 times a day, 3 times a day, and keep increasing it as their tolerance available increases. But from the care partner's perspective, how can they help their loved one? Because that is a huge quality of life issue, not only for the person experiencing the fatigue, but the family members. Right? Yeah. Like your one case study that you mentioned.
Yeah, I think the important thing, number one, is trying to avoid the pitfall of blaming the patient. I think that's probably the single most important thing. And I think that it should be approached as a team sort of approach, where the patient participates with the family in setting goals and strategy for dealing with this, so that it's understood that fatigue is part of the disorder. And, just like fluctuations are part of the disorder, or freezing is part of the disorder, try to set up a strategy, including the patient, as to what the best approach would be to doing this and what the patient would like the family to do. So there's often a fine line between nagging and encouraging, okay? And that varies, of course, with the people involved. So I think it has, in this case, it has to be a mutual endeavor in which the patient sort of gives the family member sort of instructions on how they would like it to be done. And they may have a difference of opinion on it, of course, but they should try to come to some agreement and work out a plan that they mutually agree on.
Wonderful. Well, it is at the end of our hour, and this has been a great conversation. So I want to thank you so much for spending the time and digging into a topic that, quite honestly, I'm sure is very challenging because there's not any here's the treatment plan, the best treatment approach for you, and send people on their merry way. But it's a very complex issue. So thank you for explaining it such detail about all of the different aspects of it, and how difficult it is to actually sometimes express for patients to their providers. So thank you. For those of you watching, if you want to capture your chat, in case you want to go back and review the links that we put in there, just go over to the chat box and to those three little dots and pop open the little box. It'll say save chat. You'll be able to find the links to both of his books. One of them is free. The other one is available on Amazon if you want to go back and read that. There's a really great book, like I mentioned earlier, about brain and behavior that he talks about. And one of the things that we like to do at PMD is to give a wave of gratitude to our presenters and our speakers. And I want to invite everybody, if you don't have your camera on, turn it on. We'd love to see your face and give the wave of gratitude to Dr. Friedman, because this has been a wonderful, wonderful conversation, which it will be available in a day or two on the website. But Dr. Friedman, thank you so much for sharing this expertise.
Thank you very much for listening to me. I appreciate it. Take care and good luck to everybody.
Great, thank you.
Bye-bye.